We're nearly there. The last step in this process is just to write down some ideas for possible interventions.
We worked with our government partners and we used this barrier map, this roadmap, to design an approach called proactive care, or the longer, more wonky version is proactive community case management. This model of proactive care had 3 key pieces to it. So, number 1, we trained and deployed a team of dynamic, amazing, and mainly women from the communities that they were serving as community health workers. And we deployed them to go door to door searching for patients for 2 hours every day. Second, we trained and equipped and supervised and paid and supported those community health workers to provide doorstep care, to provide a package of diagnostics and treatment for the leading causes of child death in the home. Third is rapid access clinics. We remove the user fees, the fees that they would have to pay at that clinic. We build out staff and infrastructural capacity at that clinic to make sure that there's someone there who's qualified and equipped to make the diagnosis and provide the care. So those are the 3 pieces that we did: proactive search, doorstep care, and rapid access clinic. And we can see, if we look a little more closely, how those mapped very directly from the key barriers that our patients told us about on a barrier map, right? So they told us about the barriers of cost of care, and so we removed user fees across the system. We also saw that the distance to be traveled, and so we bring care to patients and we go looking for patients. Our community health workers spend hours every day looking for patients, and to date they've conducted, I believe, 2.5 million home visits searching for patients. Third, gender inequality was a prevalent barrier that our patients brought up. And as it turned out, solving those first 2 barriers also enabled us to help start to solve for that third barrier, because by removing user fees, we're lessening the power of gender inequality, because mothers no longer have to access capital, have to access cash in order to make a decision to access care. And by bringing care into the home, the decision to leave the home doesn't need to necessarily be made in order to start getting access to healthcare. And then third, by deploying a healthcare system that was led predominantly by amazing women on the front lines, we're adding another route to bring in women's leadership and women's voices and to combat gender inequality as a barrier to access to care and child survival. So we can see how this approach that we built, we couldn't have possibly built it if we hadn't started by listening systematically to our patients and by building this barrier map to show us the way, to show us what were the potential barriers that we needed to remove on the path to care.
Now, the entire process is like done-ish when you've written down some ideas for interventions relative to each key barrier. But of course, we've laid out a really long process that involves defining questions, asking people those questions, getting transcripts written, doing a really deep read of those transcripts, building a barrier map, and then planning out interventions. But of course, every patient is different and every intervention is different. And we're actually looking at Ari's story quite a few years in. So your approach and results from this process are going to be different to Ari's, because Ari is not you and Ari's patients aren't your patients. And this is all about your patient's story.
One of the most important things that I've had to learn along my path, and that I'm still working on learning, is humility, and be constantly challenging myself, challenging that I particularly had the right idea. Because it's through that humility that we come to sit or stand alongside our patient. A mentor of mine, Peter Drobak, is an awesome guy. I was sitting with Peter in Rwanda and talking through a challenge that we were facing. And it was particularly hairy, and he said to me, he said, "Ari, as long as you are standing beside your patient, you are always facing in the right direction. And that is something, that is advice that has stayed with me, and that has helped me and helped us along this path.